Welcome everyone to today's webinar, a rather special and uniquely intimate and generative opportunity. So I'm Carol Homden, I'm the Group Chief Executive of Coram, which has launched the Coram Innovation Incubator in partnership with 9 local authorities, Microsoft and EY, and will shortly be announcing further partner joining with us. And the intention is to marshal the different types of expertise across sectors, with Coram convening that in order to identify new innovations and solutions to the problems that we together identify. Today's webinar is going to be recorded, so I hope that everyone is okay with that. And we'll be using the chat function for our questions and observations. So please do use the chat function if you are able to. We are gathered to address an extremely important macro question in one of our webinar discussion sessions. So protecting children in the post-COVID world. We are all expecting and already seeing the growth in demand. Indeed, the National Audit Office wrote a report in 2019, I think it was, in the UK, identifying the challenge of the management of demand to children's services, to children's social care in particular, even before the new villain in our story, the pandemic, arrived on the horizon. And we're really privileged today to have the opportunity to explore these issues of readiness and how we can generate new solutions and innovation, and indeed the capacity we need to rise to this challenge. And Greg, who's joining us today from Microsoft, joined Microsoft in 2020 and now has the privilege to be the worldwide public sector lead for public health and social services for Microsoft. But we're particularly fascinated in Greg's background, that he spent 19 years as a homicide detective in the Phoenix Police Department, and with a specific remit for the investigation of crimes against children, before moving into the Arizona Department of Child Safety and progressing to be its director. So I have asked Greg that he shares with you some of the learning from that journey. We are also joined by Adetosoye, who, after several years of working, many years actually, in working in children's services and in very rapidly improving those children's services, was awarded the OBE for his role in improving the service in Lambeth, before moving to be Director of Children's Services in Bromley, and was then appointed in 2019 as the Chief Executive of the London Borough of Bromley. And he is now the spokesperson for children and families for Solace, which is the Association of Chief Executives of local government in the UK. And he is, with all due declarations and privilege to me, a trustee of Coram. So we're going to first of all hear from Greg McKay, move straight on to Ade, both of whom will address the questions of how to prepare and how we meet the needs in the post-COVID era and the pressures of demand on children's services, before we open up for a more general Q&A. Please do, however, make observations in the chat, which will then be gathered as part of the feedback from the event. And of course, we will come to questions after the 2 presentations and input. And Greg, we're going to hand the floor over to you. We're not going to attempt to introduce everyone to you, but just to say that you have a very distinguished group of leaders and practitioners from across the UK domain, as well, of course, as our colleagues from Microsoft who join us from across the world. So Greg, over to you.
It's great to be here. Thank you, Carol, for inviting me. And Carol has given me the latitude to tell the story of my journey. So I don't have slides. I don't have death by PowerPoint, but I have kind of story time for you, and then kind of wrap that into some reform efforts, and how the pandemic accelerated the need for innovation in human social services, child welfare, and what we're going to do moving forward. So just basic background. Yeah, I've been at Microsoft for 6 months, and but my background before that was 20 years with the Phoenix Police Department, which was about the 5th largest city in America, investigating sexual crimes, child abuse, internet exploitation. And during that time, my wife and I actually became foster parents for a victim of very brutal crimes that I investigated. And she was a 4-year-old child. And so we got a glimpse of what the foster care system looks like from a provider standpoint or a family standpoint, which really informed me later in life, which I did not know was going to happen, but did. And, thankfully that child is now at a university and grown up to be extremely successful and wonderful. So it came to a good end. Moving forward, I worked homicide, as Carol said, and with the distinction, not by choice, but by former experience, child-related death and child-related homicide. And I did that for several years, and there was a rash of high-profile child deaths in Arizona, quite like happens anywhere in the United States or in the UK or anywhere in the world, really, where the government had responded on prior occasions, maybe multiple occasions, yet we were reading the headlines about a child murdered despite what some would say were failed interventions by systems of care. So little did I know that a governor and the politicians were having task forces about how to reduce child fatalities and how to reform the system in Arizona. And I got voluntold or borrowed from the Phoenix Police Homicide Unit to start and run a new legislative office in Arizona that merged criminal investigative expertise with child protective services social workers to hopefully accrue better outcomes for children. And, so I did that. It was actually a startup. And we started up with 25 people, $1.7 million to investigate 11,000 criminal child abuse cases. So you could all say, well, what is that? That's just political, task forcing. That is not really making a meaningful impact. But we really did make some major strides in the way that the merging of these expertises came together. We eventually grew this into a $11 million, 120-person unit that's still in existence today. But I can tell you from my time there, when I came in as a cop that thought, well, social workers, maybe they don't know how to investigate these types of criminal involved abuse and neglect cases, and thus bad things happen. What I came to realize is it's not about that. It's about capacity. And the system in Arizona was so overwhelmed with too much demand, frankly, from way too many prior reform efforts that resulted in many new laws and amendments to law that added more demand on the child welfare system without any extra resourcing and capacity. So what happens? Well, you have worse outcomes as time goes on. So in Arizona, I discovered as we were investigating the murder of a 11-month-old baby whom had been reported to the child abuse hotline 24 days earlier with 2 broken arms, likely inflicted trauma. And my team and I were investigating the homicide and found that the case was classified as not investigated or no means to locate. And that led me to find 7,000 other classified cases tagged not investigated. And this created a national, I think international scandal about Arizona, as the government agency responsible for protecting children broke the law 7,000 times. So the system was was abolished here in Arizona. The governor created a new standalone cabinet agency, and I eventually was tapped to lead the entire system in Arizona. And boy, was I unprepared to do that. But the bottom line was, it was about capacity. It was about an organization that had 50% turnover, that had way too many cases coming in every day, every week, every month, with way too few people to deal with that, and some administrators that were kind of backed into a corner on reporting out their data to the legislature and their appropriators, came up with an administrative process to reduce that volume. And of course, that resulted in terrible things. So moving forward, my first week on the job, I found that our child abuse hotline that was receiving 150,000 calls a year was not answering the phone. In fact, nearly 40% of callers hung up or abandoned the call before making an allegation of abuse or neglect. I found out that our organization only responded about 50% of the time to assess child safety. I found that we had over 20,000 backlogged investigations that had not been completed or even started, with another about 4,000 or 5,000 coming in every month. We had 45% turnover. We had the highest rate of foster care growth in America, which was 92% growth to the foster care system in 7 years, which caused the capacity crisis. And because of that, we had no more foster homes. We had no group homes. We had no shelters. And children were removed from their dangerous or unsafe homes and sleeping in government offices or in government workers' cars or in motels with caseworkers. So obviously, that was a terrible situation. I found we had a $67 million budget shortfall and I could not make payroll. And when I walked into my office every day, there were protesters blocking the doors. And when I got home, I found media on my doorstep frightening my family. So these were terrible times, obviously. But in the long run, we did turn this around, and eventually we ended up with the #1 hotline in America with a 28-second or less speed of answer, and a 2 to 3% hang-up rate. We eliminated our entire backlog of cases. We dropped the foster care growth and in fact safely reduced foster care growth by 25%. We cut group homes and shelters by 78%. We expanded the use of kin. And the most important thing to note there is we did not have any rise in reentry to foster care after children were either returned home or adopted. And we also didn't have any rise in recurrent abuse rates, which means the system was overreacting out of duress and removing the wrong children from families that should not have their children removed, which was absolutely tragic, obviously. So we corrected all those things. And in the process, we implemented a new technology system. So as some of you will know, the politicians and the appropriators don't usually appropriate enough money in these areas unless it's on the headlines of the front page or it's on the news and people are really being attacked on these issues. Then kind of that dictates will and energy and money. So in Arizona, they said the #1 reason for all these awful things that happened was the 26-year-old antiquated technology system. Now, was that the reason? No. Was that a big part of the reason? Absolutely. Being tied to a cubicle in a brick and mortar office place on a mainframe computer without real-time information, without the ability to interface with children and families out in the field freely was a big, big deficit. But mainly, we lacked business processes throughout the entire organization that even with a brand new technology system, we would not have been able to repair. But politically, I leveraged that will and that appropriation, and we eventually did replace our system with shocking, a dynamics child welfare information system that's federally approved and was match funded. And it took us about 4 or 5 years to do that. So I just wanted to give you a little bit of that background and then talk a little bit about the problem here in the States. And forgive me for giving references about the US. I know this is a worldwide role. I know you all are in the UK, but these are universal problems and I'm sure you can relate to them. But just to talk about the size and scope of the issue here in America, there's about 7.8 million children referred per year to the Child Protective System. And that usually culminates into about 3.5 million investigations. And in America, there is about 460,000 children living out of home. And the average length of stay for kids out of home is about 15 months. So that's likely too long. In Arizona, kids were staying so long because the system had collapsed that we had more kids coming in than leaving, which collapsed our entire system. So the numbers also are about 56% of children in the US return home to reunification to their birth families. And about 27% of kids in the US go to adoption, with the remainder either going to some type of guardianship or even aging out of the foster care system. So that's kind of the size. But just talking about moving forward, reforms usually are struck by high-profile catastrophic events involving children. Then there is political will, then there is money, then there are new rigors and more demands, and then eventually the system falls down again. So I can tell you the reason I am at Microsoft is I've been through the reforms, and I can tell you that in the year of 2002, sadly, I was part of a team that retrieved the body of a young child from a canal that was murdered and had been the subject of 5 or 6 prior reports. And little did I know, standing on that canal bank as a cop, that the reforms that would be born out of that event, out of that day, would lead to the cascading fall of the system 7 or 8 years later that I eventually came in to help solve. So quite ironic. But the point really has to be, how do you build capacity in social services, child welfare systems, so you have the outcomes that you hope to have? Resourcing is never going to be at the level that we need and want it to be to meet the demands and meet the needs of families and children. So to me, I thought, well, I've been through all the reforms. I worked the streets. I worked as a detective. I worked criminal trials. I was part of the family and child system for a very long time. And I can tell you that the reforms just haven't worked. And so I really do feel like innovation and technology is the way to really provoke long-lasting changes and better outcomes for all of social services, but obviously child welfare. And the way that they would do that is by forced multiplication or capacity building. So what did we see happen with COVID? We saw an acceleration of what probably in the United States would have taken 10 to 12 years to happen, had to happen at lightning speed. And what I mean is not vaccines, but I mean, how do you continue to find children, make sure they're safe, and serve families and foster children during lockdowns, during isolation, during imposed, restrictions? And sadly, a lot of places in the United States stopped doing their job, which was tragic, obviously. Although COVID has been an awful time, it really accelerated the use of virtual means to do the work. Government people are so curmudgeonly, at least in the United States. They think butts need to be in seats. I need to be able to track John and Mary and see what they're doing every day, or else I don't think they're doing what they need to be doing. So they have this kind of tethered to the office mentality, when we know that people can work effectively, more effectively, in fact, with the child, with the family, at the courthouse, in the hospital, in the classroom, than they can in some cubicle in some government office someplace. So those mindsets have changed. People have realized, wow, I can get performance and I can get workforce management and I can get accountability done virtually. So this might just work out for the future. The number, just for an example, the mandated reporting. So in the United States, we've had about a 60+% drop in calls to child abuse hotlines reporting abuse and neglect. Now, and that was because of the, pandemic imposed lockdowns, obviously. So does that mean kids aren't being harmed or living in pretty scary circumstances? Unfortunately, no. But it did reduce the amount of volume coming into that system front end, artificially, in fact. 21% of callers in the United States are from the education system, so whether that's childcare or elementary school or whatever that might be. About 20% of those calls come from law enforcement, about 15% from the medical profession, and then kind of the remainder, community or family members. So when you knock out a large portion of those mandated reporters, you have kids in isolation without help, without resources, which is frightening. So moving forward, what I anticipate, and I hope I'm wrong, is that kind of like what happened in Arizona and many other states over the years when bad things happen and, capacity was waning and demand outpaced resources on a minute by minute basis, the system starts to fall down across the board. So I really am afraid that as COVID kind of dissipates, and hopefully it is, and vaccines work and people go back to life and kids go back to school, mandated reporters are going to start hearing about all that which occurred over the prior months and year that are going to need to be responded to by government. And so the first stop to that is going to be child abuse hotline, central intake systems, and they are going to become inundated with calls and hence long wait times and all these things. If we don't put forth a solution to help innovate within these intake systems, then you're going to have a glut that's going to crush that front end of the system, followed by now those reports are going to move quickly downstream to the investigations and assessment teams that are going to now all of a sudden, in Arizona, when I started, every caseworker had on average 160 cases per person. That's tragic. Or 90 kids per social worker to manage in foster care. That's untenable, obviously. When I left, the average caseload was 15 investigations per person and 20 children in foster care per caseworker. That's feasible. But what happens is, as too many investigations happen, people can't manage them. They start to fear-based respond by removing children, maybe because they can't mitigate problems on the ground. Kids start to enter the foster care system. That system starts to rise, service array starts to wane. There's not enough beds available anymore, and you have the same disaster. So help at the intake systems, help with mobility solutions to get even caseworkers stuck on antiquated mainframe systems. There's ways to buy, like I did in Arizona, a quick win solution to get technology in the hands of case managers and mobility to get them out of the office and in front of people. There's automated ways to streamline documentation, which is obviously one of the biggest time sucks of their day. There's a variety of things that can be done from the system's front door to the system's back door that will help mitigate the eventual kind of collapsing of these systems. I really think that the trick moving forward is that the policymakers, the leaders like Ada, you're going to hear from in a minute, those people that used to lead systems and are making policy and are driving practice need to come together now and say, okay, what did we learn from COVID? what did we learn from the years before COVID? And how do we take now the winnings of certain technology and the ability to work remotely and work virtually to say, prioritize better, to say that many cases of these types of cases can be handled in a more remote or virtual fashion, thus freeing up all that vital people capacity to actually get out and get in front of those most critical person-to-person, face-to-face contacts. Because what happens is they don't prioritize. If you have 200 cases and you come to work today and you go out and knock on someone's door because you have an allegation about a little child that's being neglected, and no one answers that door, well, the reality is you put a card on that door, please call me, I was at your door, and you leave and you work on your other 159 cases until 3 months later when you see on the news media that child that you put a card on the door didn't survive, which is probably the worst possible moment that a social worker or a cop or investigator can experience. So the ability to prioritize is key. Move a lot of that noise that can be done by technology over this way while saying this needs to be done. And the same thing goes for courts. There has been more family, juvenile, and dependency court involvement in the last year during COVID lockdowns, 67% more court participation during COVID through virtual means than prior to COVID. So families are becoming more involved. Not every family needs somebody to come and be interrogatory and investigate them. Some families just need resources and support and other ways to engage without feeling so under the spotlight, so to speak. So I really think this is an opportunity for us to build capacity, prioritize better, use some of the technology advancements that have sparked up over this last year, make them better, develop policy and practice around those, empower workforces, curb turnover, and really seek some better outcomes for children and families in America, in the UK, and everywhere that we can be involved in this movement. So I'm going to stop there and thank you all for listening to my story time, and obviously be available for questions, and glad to engage now or even days and weeks to come, and hand it over to Ade. Thank you.
Thank you very much, Greg. That's one hell of a story, and we'll look forward to quizzing you in a little while. But as you say, we're going to hear immediately from Ade, bringing the UK perspective. Some awe-inspiring statistics there, Ade. But over to you, and to hear your story and reflections.
Thank you, Carol, and my thanks to Greg. The storytelling was fascinating in the sense the way you articulated how things are done in the States, and I can see quite a lot of learning that we in the UK can actually take away from what you've said. And Carol, my thanks to you and colleagues for arranging the session today. So one of the ground rules was not to repeat what Greg actually says, and I will try not to repeat exactly what you've actually gone through. The three key things for me are just really reflecting on what you said, which is perhaps where I'm really going to start the conversation, which is around the policy decision making by colleagues in the UK. So what do we have in place? We do have a review of children's social care, which by Josh McAllister, and I think there is an opportunity for us as a group of practitioners and colleagues to really, as part of the terms of reference through Carol and others, let's really get a sense of some of the key issues around the use of technology in addressing some of the wider social care challenges that I'm going to go through. So I think there is definitely something there. The second point, perhaps on the child protection pre-COVID, I think going back to what Greg said, similar in the context of the UK, our system in terms of safeguarding child protection also is actually built on partnership working, working, of course, with different professionals. I'm really using that as an opportunity to safeguard our most vulnerable children. You're absolutely right that what COVID did was really to enable every single local authority in my national role as the policy lead for children. The key messages that we're picking from all the different local authorities in the UK is how, as a result of COVID, people, practitioners, managers, people like myself, to change the way that we all respond to safeguarding and to child protection. And I think 14 months or so down the line, we clearly need to really take the time and think about things that actually worked really well during the pandemic and the things that we might want to take across during the endemic stage of where we are in terms of business as usual. And I think the point you made is absolutely well said. So for me in Bromley, similar to my other colleagues in local government, we had to adapt by actually having hybrid ways of working, virtual conferences in terms of meetings, virtual visits to children known to us, which again, we clearly would not have been able to do in the same way pre-COVID. So every single thing, Greg, that you said. I guess the real challenge for me is that whilst we take on board the key issues at the back of COVID, bearing in mind post-lockdown in the last few weeks, so we've actually seen an increase in the number of referrals to children's social care services. We've seen an increase in demand. We've seen an increase in terms of care proceedings, in terms of cases in court. We've seen an increase in the spend of local government in placements cost, and even in terms of referrals. So in my own local authority, I know one of my senior managers, Rachel Dolly's on the call. We've seen an increase in the number of families coming to us. The question then comes in, as rightly said, Greg, it's unlikely we're going to have the extra funding from central government to tackle these. So the issue for us as sector leaders, what can we actually do differently to manage demand? Why is it that during the pandemic, we were able to evolve into working differently, but at the same time still meeting our statutory needs? Why is it during the pandemic, which again, we were able to deliver some of the key services virtually that we never had before? So once again, I'm saying that the landscape is actually rosy in terms of what we did. Having said that, there are still key things that we still need to address in terms of going forward within social care. So the three key things for me, colleagues, on these is that you might recall in 1986, Kimberly Carlisle, A Child in Mind. This again was at the back of a serious case review whereby a child wasn't actually seen. So whether landscape we get into in social care, I think going back to Greg, your point, we must ensure the face-to-face interaction with children is something we must not actually do away with. What happened in 1986 to Kimberly Carlisle is still around, whereby some local authority colleagues, I must say not Bromley, took the view not to really have some of our social workers out even during the pandemic. And some local authorities, going back to what you said, Greg, took the decision not to proactively really follow through some of the children who we are worried about. So in whether platform, through the work we are beginning to think about, whatever system we design must always have the child in mind in terms of the capacity for our frontline social workers to go out, for the partners to go out, for them to ensure that a child's actually seen in terms of that face-to-face. You cannot, in social care, have a substitute for that. In the sense that most families, again, in my own time in social care, I've never come across a family or parent where they say to you, this is what I've been doing to abuse my child. The skill base of social workers is important, and that skill base is actually through observation, through visiting, really challenging where they can, at the same time supporting families. So whatever system we design must take account of that. The second thing for me is that what are the key benefits in terms of virtual ways of working? I think going back to what Greg said, it's actually doable in the same way during COVID, whereby agencies actually received a greater level of support. So instead of us actually meeting in a physical location to have a meeting about a child, we as professionals, even with a family, can still have that virtually. The amount saved in terms of traveling, getting the right people to join a meeting is something that we can all benefit from. So again, I'll speak from our local authority, tested that with a few local authorities, whereby the challenges in the past of getting GPs and medical practitioners at conferences was actually reduced during COVID, in the sense that the traveling time of 2 hours to a meeting location to then spend another hour or two wasn't there. And what the GPs actually fed back to us was being able to really contribute virtually during meetings. So I think, again, going back to what Greg said, one of the key things that we can build upon is our own partner agencies can actually contribute virtually. And I think there must be a way to continue to do that. The third for me, if I may, is that, again, in the context of working with families, it might still be the case that some of the interventions that we provide to families in the way during COVID, we were able to provide those virtually. The take-up, again, not just in Bromley, was absolutely superb. And I think I really would like to see more of it. Why is it that all counselling must be in a physical space cubicle one-to-one? Why can't we provide more services to our users virtually by redesigning some of the key programs that we've been delivering on a physical face-to-face basis? And I think I feel strongly about this, which is that our intervention in social care can easily go into the virtual space. And the last thing for me on the same issue is that we need to recognise, and it comes back to how we engage with families, that whatever system we design, there must still be an opportunity for practitioners to also have the opportunity to have one-to-one sessions with parents on a face-to-face basis. One of the key things that we know, again, in terms of practice, is that participation is not the same as engagement. I can participate in a meeting, but I engage. I can participate in really getting my child off a child protection list, but by not really engaging. So we still need to recognise that there is the opportunity in whatever system we design that allows us to be really intrusive, if I can say that, to really go into families and ask the difficult and challenging questions, but at the same time to be able to provide support virtually. So I guess in summary, where does that really take us? So going back to some of the things that we as policymakers need to think about, 4 key things for me. Can we provide more services online? I think the case has been made during COVID, which is yes. The second, in terms of some of our own professional structures, be it strategy meetings and case conferences and other meetings that we have as professionals, I take it that the case has also been made really to move on and really do present those on a virtual basis. I think point well made. I think the third for me is that when you've actually got some of the cross-cutting issues, I know in London, for example, we still have a challenge in terms of getting our courts to sit virtually and really agree to orders virtually, and even to really present some of our cases. So that's one of the key things that on a wider micro level, we might just want to get some of our policy decision makers in organizations such as the judiciary, whereby we also need to make some radical changes. The final point for me in terms of technology is also what can we actually do around you described how you change the referral processes in your own government in Arizona. You know, what can we actually do with a vast amount of information that we've got in local government, really to start making use of these around predicting where demands and interventions and really getting the best for our children in terms of the outcomes for them. And I think there is a way that even through Microsoft, through the work we're doing in Coram, collectively, that's one area to really try and really make sense of in terms of the capacity going in, the vast level of amount of information that we've got. We can also use these insurance services to improve outcomes. So I'm going to stop there, Carol, which again, not repeating what Greg said, but being able to add one or two extra domains, which is that there is a place, of course, in social care, there is a place in terms of policy formulation, but we still need to recognise that relevance in terms of freeing up resources. As I said to my lead member only last week, that the quantum that I free up through working differently must go back to the service. So all this is going to do in terms of that critical message is that I'm freeing up time to provide more time for face-to-face intervention. I'm freeing up more time to allow our own colleagues to really keep knocking on the doors. I'm freeing up more time, which again is what I told my Solly's colleagues, to really find different ways of actually providing our services, be it in recruitment, be it in terms of direct provision. And I think we clearly need not make a fundamental mistake, which is that we're working in a service that isn't well funded, and through wherever we innovate, personally, I'll say the gains must still be reinvested back into those services. We're not in any way near taking the gains through our new ways of working, through innovation, and using that in other services such as cleaning and different services. I think at this stage, my own plea collectively is that the savings must really go back to the key services. Thank you, Carol, and thank you, Greg, as well.
Thank you very much, Ade. And a lot of synergy between what you and Greg were saying, which actually reinforces, I think, very much, Greg, what we found when I joined your colleagues with the courts in Arizona, although interestingly, Greg had a judicial reflection on that. I wonder whether we feel they're going far enough, fast enough in that judicial realm, but nonetheless, that's for another day. So really, we have with us the most extraordinary expertise and transatlantic perspective as we, in our small ways, here in the Coram Innovation Incubator with our partnerships, try to galvanise that capacity. Because one of the things, Greg, that you will be aware of, Ade, clearly is that we conducted the first ever survey on the capacity to innovate. And that was in itself a very illuminating ingredient in this, which is, do we actually have the capacity in the children's services domain to innovate, to realise what you have just spoken about? So did you have that? I shall ask the first question whilst people gather their thoughts, but did you have to take particular steps to invest in the capacity to effect the capacity change. How did you do that? It's for you, Greg.
Yeah, interesting question. So, I referenced how we did a system replacement. We moved off of our 27-year mainframe computer to, a cloud-based system. But, in reality, it was a scandal that propelled that to happen and that to be appropriated. And but there's an awful lot of assessment of readiness and maturity of an organization to know if you can even embark upon something like that. Like I had mentioned, if we'd have just tried to replace the system without going back and correcting all of our either non-existent or broken business processes within running the organization, then the technology system would have really fallen flat. But there is, whether it's the risk of a replacement or the cost of a replacement or an organization's maturity or readiness for a replacement, those are deep questions. And that's why a lot of the work that I'm trying to do here in my new role is say, some places might be ready for that big system replacement, high speed, but it took us 5 years to do that. And it was a grueling experience. And a lot of change management had to go into that. But I guess I would say the single biggest thing that we had a huge cultural shift in Arizona. When I started, the organization was obviously coming out of a scandal. They were embarrassed about their job. They would lie about their employment to friends at parties. They were ashamed to be part of this organization. And they were afraid and they were making fear-based decisions daily. And over time, we corrected the culture in the organization largely, basically by having people's back. They felt like, they were cared about, they were going to be protected. When something bad happened, I was the first one on camera saying, look, bad people do bad things, and we're not going to castigate this employee publicly for what they did or didn't do. These are system-related failures. That changed the morale greatly. And when it came to being ready then for that system replacement, bringing in the people from the organization to build the requirements. What does the system need to have? How is your work going to be better? How do children and families have better outcomes? What will make it work? So they put their stamp on this system. So when you look back at the build out of something like this, all of these employees took part in creating it. So they're memorialized, so to speak, in that. But if an organization doesn't have the bandwidth to do it, you could do other more, quick wins. Just a quick last example. I was getting pounded by the press every minute of the day, pounded by the legislature, and pounded by lobbyists when I was trying to embark upon this big system replacement. And I needed relief now, not in 5 years. And I was able to go out and quickly, within 1 month, adopt a mobility system where I gave caseworkers tablets. I gave them this mobility product. It linked back to our really old mainframe, which wasn't optimum, but they felt like they had the technology at their fingertips. They felt like someone cared. They could work at court. They could work at the hospital. They could work in someone's living room or in the school. And it bought me a lot of runway to keep fixing and keep going towards these really big, long-term sustainable projects, So for those that are ready, hey, it's a big change management exercise. For those that aren't, there's ways to provide modernization to your systems to get immediate wins, thus buying you the runway to get those long-term wins.
Ada, is that something you recognize?
Yeah, absolutely right. I think, the key point, which in terms of the key drivers in this country, you do get bad Ofsted, which again through the regulators, that might give you or the local authority a reason to press on innovation and press on doing things differently. There is always an opportunity there, which is slightly different, Greg, to what you said in the UK, which is a point inspection allows the focus on children, which must be exploited, if I can say that, in the sense that the only time that you can actually get most of the key reforms in, as you see in a number of different local authorities, even including my own local authority 3 years or 4 ago at the back of the failed Ofsted. We used that as an opportunity to make all the key changes that was actually required. And I think just really just reflected again on the piece from Arizona, social workers and managers did not really feel comfortable telling anyone that they worked for an organization that's actually just failed a major inspection. So I think, being able to seize the opportunities at the right time, really to force through some of the key changes. So totally agree, Cara.
Thank you. We've got a question on the chat. I'm not actually quite sure who's asked it, so struggling to understand where the hands are. But the question is what you think about Michael Sanders' comment. So from the What Works Centre, you can probably see it here on the chat. Yeah. On predictive tools. Yeah, who's asked that question? Is it you, Catherine? Have you come to the fore? But the question that in the pandemic, quote, all our data scrambled to the point of uselessness in any case. And their research suggests that AI tools in prediction in children's social care has, quote, dangerous blind spots and is not fit for purpose.
Yeah, I mean, Cara, I'm quite happy, obviously, to have a go. And just really for colleagues who've just joined, I learned my trade. And from my colleague, my senior, who's on the call, Yashi. And one of the key things, just going back to the point that I made, we're never going to have a replacement to the face-to-face. I'm going to be nosy, I'm going to see little Johnny, and I'm going to ask the parents to allow me to go to little Johnny's room. I really need to get a sense of what's going on for this child. And I think Greg also said the same in terms of no replacement for face-to-face. The key question that comes in terms of AI, and I know I read the piece, I saw it as well, it comes to the level that you take AI, and I think it's in different local authorities. So a good example could be through artificial intelligence. You might take it that is slightly different to adult social care, whereby you're using telecare, for example, to predict and to really get people out when somebody is likely to fall and all of those. But in the same way, in children's services, it might be as basic as what is the data telling me? And I want to use AI to really bring out what's going on in a particular ward in my own local authority. And I know quite a lot of people get carried away by AI thinking it's at the same level as, assisted technology and, using AI to get people out of bed and all of those. What I think we need to really recognize in social care is actually, if AI is applied really well, it's absolutely to enable us to add to the knowledge base that we've got. And it might be as simple as I've got data from different areas. What is it? What can I actually use the data for? And I give you a good example. I'm not saying it's the best one. So during COVID, we had 4 or 5 different systems in Bromley for the first time, whereby my council tax data was actually used on test and trace in terms of what are the people testing positive on COVID, what are the key things that we can actually use our data for. So for me, as long as we're not really going to the extreme end, that there is a place for AI, and it might, as I said, which I've used in my own local authority, which is, what is going on to a particular network? What can we do in terms of a massive child abuse investigation? AI will enable you to really plot some of the key variables in the context. So I'm fairly relaxed about it, and I think part of what we need to educate colleagues on across is actually the different stages of AI in terms of what is it that you're trying to achieve, as opposed to what people see in terms of robotics really taking over, reading all the case files, robotics being sent to visit. That's not where I think, and I speak for Greg on me, that's not the sense that we've created today. Sorry, Greg.
Well,
Yeah.
I think I was going to bring in Kenya, actually, Greg, who was going to comment, was trying to comment there on the chat about establishing the principles, of what your use is.
I'll wait till Kenya's done to respond to some of that. Go ahead, Kenya.
Oh, I was just going to say it's really important that from the onset, and I think I've mentioned this before, about establishing principles for responsible and ethical innovation. So making sure that it's fair, that it's transparent, is the data set, does it have any inherent biases, et cetera, et cetera. So it's important to start thinking about these, and we could help you establish some of those kind of questions you want to start asking before you get into that kind of, into that realm.
Yeah, thanks, Kenya.
Yeah.
Greg, did you want to comment?
Yeah, I do actually. It's a great topic, and I think the biggest shortcoming of the systems, like I can tell you from my time as a homicide investigator working a child's death to running the system, that almost every catastrophic outcome like that was known to multiple systems. Yet all the systems were blind to the other systems' interactions. And it was so frustrating for me to now post-death be getting all the information from, behavioral health and from law enforcement and from education and from subsidies and from child welfare in different states around the country. So there has to be a reckoning someday of integrating and marrying the data from these disconnected relevant system partners to get in the way of some of these things. That's long term. But when it comes to AI, people get very bristly about AI becoming a predictor in that critical decision. There is no harder decision in the world than to decide to leave a child in a home that might have some risks, or to take a child away from a family. You're damned if you do and damned if you don't. So the idea that some algorithm or actuarial model is going to tell you what to do is frankly insulting to people to do the work, because anyone who does the work knows dealing with people with frailties, serious mental health issues, serious substance use issues, serious trauma issues, they're the most unpredictable people to make decisions about there are. So now you're saying there's going to be some AI that's going to help do that. I do think that predictive analytics and data is going to be very influential in that prioritization. So taking information from past cases, from other systems, and using those to inform on priority and to inform on what's the proper service plan approach to ameliorating the issues with the families. I think those are great possibilities. I think there's other really neat AI possibilities, for instance, in kind of grabbing out information from these voluminous files. I mean, I remember when I used to get medical records, there are hundreds and hundreds and hundreds of documents. And to be able to distill that down to make quick decisions was very, very hard. So I think that some of the technology that can do that, again, in a force multiplying kind of way, not in a replacing the human decision factor, but in a building capacity for the human decision factor, I think is the key.
I think we agree that all. And one of the things I was going to say was just perhaps at some of the softer end of the spectrum, moving away from the hardest of the child protection end. In the youth service arena, for example, do we really use the predictive power of those analytics to do with things like school attendance patterns and missed appointments, or points of intervention or ways of intervening? So in a past life, identifying that young people who had a driving license were substantially more likely to succeed in relation to this particular program, meant that it was the kind of question that you could ask without stigma or without being preemptive in your judgments, but which would be an indicator or a kind of correlative indicator of whether the odds were stacked for or against. So you were able to put in more attention and more wrapping. So I personally think that there's a lot further we could go in using that. And indeed, if we were in a different type of arena, we would find it strange that we didn't use this vast amount of data that we have more predictively. There's another hand up. Would you like to come in? Because I'm not quite sure. It's you, Renika. I know you would agree with that. So
Yes, well, I mean, I think that if we don't use AI for our most vulnerable, then it's an equalities question, because they have to have access to what other people have access to. However, I have a problem, and that's to do with trust. And there's decades of research now on predictives, because we know about adverse childhood experiences and the social determinants of health and well-being. And we know that they are people and children hidden in plain sight. Every teacher will tell you the child who probably will drop out of school at secondary, and that then is a very great predictor for negative trajectories. The people in our prison population, in our psychotic wards, in our youth justice system, they are people who have suffered adverse childhood experiences. And I think perhaps this isn't the seminar for it, but it's important to think how we raise the trust of our population, that actually what we predict and what we already know and actually can predict is dealt with in a social justice way. And I think what the pandemic has taught us is really about how we have to deal with equality for all our people in America. And that was really, it told me another kind of view of America, the people waiting, although I know a bit about it, and certainly in this country and the world, taking an international perspective.
Mm-hmm. Did either of you want to comment in relation to that observation? Ade, are you?
I think points well made, and I think Renika is right, but at the same time, we also need to be mindful of the previous point made, which is that to participate is not the same as being engaged. And we need to recognize that the treatment in terms of intervention for a particular family with unique sets of characteristics similar to the next family doesn't always lead to the same solution, which is where that real essence of having professionals as they are to really take those individual cases. The cross-fertilization perhaps might be in terms of intervention, really to say, yes, there is a parenting group somebody can go into in terms of learning new skills. So there is a place there, but in terms of trying to analyze, that there is that real sense of obviously making use of available data, but the uniqueness to that particular family is something that I carry on seeing and our professionals will continue to do.
Okay, thanks, Ade. Thank you, Renika. And there's a point here Katrina's raised, Ade, on the chat, which you can see about, well, we had a go. I think it was called Contact Point. Now that went brilliantly, didn't it? So, yeah, what do we learn from that?
My take is no different to test and trace. So anything imposed by government does not work locally, full stop. If you go back to the example that Greg gave, was actually determined locally. If you were to look at the success for colleagues who might not be close to test and trace, the intervention in terms of local government stepping in is actually what's really now making a centrally imposed system work. So if there is another way of actually trying to look at these, what I probably would say my own local authority, and likewise in a number of local authorities, is locally where people have designed a system to say it makes sense for us in social care to also have the data around children with special educational needs. It makes sense to know what their attendance data is in terms of local education services. It makes sense also to link where possible with the local NHS. So in a way, on the local systems, I think you do have a better way of really getting that done, as opposed to anything centrally imposed, which was one of the demise of contact points, in my view. And apologies to central government colleagues on the call.
Well, just to raise a slightly different issue, stepping back with a wide perspective across different local authorities or states in the US, I noticed that children's chances of an equal chance have not actually improved much over the decades. So, you know, continuous improvement is obviously a good objective, but not if continuous improvement is starting from such a low point that the aspiration is actually at best the mediocre. And I noticed from the National Audit Office report that, you know, they were really waving a flag about the fact that 50% of the variation in performance between areas could be attributed to genuinely different local circumstances, demographics or economy, and 50% not. So yeah. Is the local solution always the right solution just because it's popular to the local? Or do children have an absolute right to some common service standard in something called a nation?
I mean, I'm sure Greg will come in and share the views from the states. I think, Carol, the latter is actually right in terms of the aspirations that we've got for our own children must be the same for children in public care or children known to public services. My take on this is that for children coming into care, going back to what Greg said earlier on, it's always a difficult decision to be made. And if the state cannot guarantee an improvement in the lives of those children, I've said it publicly, then it's an abuse of the state, whereby a child's removed as a result of abuse, even to then be abused by the state, whereby the outcomes as bad as the child obviously staying at home. And I think there is a view out there, and I think we need to do more. The second point you raised, you're absolutely right, Carol, in terms of leadership in local government, is again something that we need to be mindful of. And I gave an example, saying, not crediting anything to myself, that the same social workers, by and largely, and managers, including Rachel, who is somewhere on the line from Bromley, were the same managers who were around in my own local authority when Bromley was actually told by or judged by Ofsted as inadequate, one of the worst in local government. And the same the same social workers and managers, by and large, were the same ones that turned it around. So the key question, Carol, that comes back to your point, which is there is a place for leadership, but in itself, leadership is not all the answers to it. No. When you've got multiple deprivation, whereby families are struggling, multiple deprivation in terms of opportunities, then it becomes more challenging, even with the right leadership, to turn things around.
Mm. So, Greg, just to put that in perspective for us, you know, Arizona was in a terrible place. It probably wasn't alone out of all of the states. And you talked about that arc of investment and return. You know, yeah. How big is what we would call the postcode lottery in the United States, and has the Arizona lesson been taken up statewide? You know, with all the other states.
Yeah, so in 1.2 before that just to keep in mind for some of the prior question and commentary there, is that as a government agency, many of the things that would be indicators of some type of adverse event or outcome are really prohibited from government intervention. So oftentimes you have information, like people are making good points about school attendance records and the potential for somebody who was released from prison living in a home with a child, and all these different things that everybody knows. These are kind of red flags So from a primary prevention standpoint, how do you take data and information and red flags and garner some type of activity to prevent what could be coming down the line? And statutorily, at least in America, government is wholly prohibited from that kind of activity. In order for you to engage legally, you need an allegation that meets certain criteria within your jurisdiction. And if not those things, you're not permitted to engage, So, that's a long-term kind of a policy play there. But just to talk about some of the construct here, my budget in Arizona was $980 million annual budget. Of that budget,
that's bigger than Bromley, isn't it?
Yeah.
About 600 million of that almost $1 billion budget came from the federal government. The rest was state general fund. And, the federal government has their scoring on compliance, certain practices that they require, certain outcome data they require. And without those things, they could sanction you and keep your money. But frankly, the state of child welfare in America is in such a state that the federal government is an enabler. They're supposed to partner with you and help you fund for better outcomes for children and families. But much of the time, people are in violation of all the compliance standards. So the federal government can either sanction you and keep your money, but politically, that's a disaster. Who's going to stand there and say, well, we took half of Arizona's money away because they weren't performing well? So, there's a fine line between regulatory and compliance and kind of carrots and sticks, when it comes to these organizations and how they lead moving forward. I think the federal governments, at least here, could play a bigger role in, for instance, when it comes to technology. The federal government paid for, matched dollar for dollar, my costs to implement a new child welfare information system that's up to date, innovative. And then they will also continue to pay dollar for dollar maintenance into the future as long as we have this system. In order to get that, we had to build the system in compliance with the federal government. And we did that. But what the federal government, or governments maybe even over there, need to do is drive some of these integrations to say, look, in order for us to spend $100 million on this project, we need integration points for education, for medical, for behavioral health. Without it, we're not paying. You guys got to get your data privacy issues worked out, public policy issues worked out, so that the system is informing on kind of that 360 view of children and families that we all want. I think the only really way to get there, because there's too many disparate systems, there's too many policies and security measures out there that have frankly created this nightmare for us to have everyone's on a different system and none of them communicate. And then we're all standing over the same poor child or family outcome saying, geez, why didn't we know? So I think there's opportunity there to kind of use that money and that match funding to drive certain integrations of information that would give us a more holistic view.
And speaking on behalf perhaps of our service users, and certainly in the domain outside children's child protection intervention, I kind of sit there and say, well, if only there was the confidence that actually there would be a response if you ask for help. So, it's back to your point, Greg, which is when you were answering a sixth of the calls, you can see that as being, well, those were referrals, those were alerts. Another way would be to say those were actually points missed, where families were turning to their state, where they paid their taxes, to actually say, I could do with a bit of help now, please, guys. And what they get is an assessment, rather than some help. And, that kind of notion of how we turn that, and there's an implication at the bottom of that, really, in Amanda's question here in the chat, which is about, there's no strategic financial settlement from government. And so that conundrum, does it take a child death and a crisis and baby Peter? Does it take a catastrophic or continued failure from the point of view of Ofsted inspection. We've had the government experiment in the UK with the children's trusts, but that seems to have gone into the too expensive bracket. You know, as a charity chief exec, I would be asked, how much money do you need and what do you need it for?
Yeah.
So,
yeah.
Yeah.
No, I think Carol's point well made. Just really to pick up on the 2 points, one from Amanda and from yourself. So again, at the back of COVID, if we take the crises in children's services without really saying, you know, to the extreme end of calling it a pandemic, there is funding, there is money. And I think what we need to really focus on, Carol, going back to what you said, is that distinction between help, which is there is a requirement for citizens of this country to ask for help, and for the help to be provided by the state. And I think if that's the working premise, then you then have that money, clearly environment where the money will flow. We're not there, and I think that's one of the key things in terms of policy direction, really focusing on that. Whilst again, I recognise in the NHS, the funding is different. You could argue the case that even in social care, not just children's social care, but even adult social care, one of the key conversations later on is that funding in terms of the settlement around fiscal agreement with central government. And I think that will help to unlock a number of the barriers that we've got. The second point that Amanda made, you're absolutely right. I've never been in social care where we've not had an increase in demand, an increase in placement, an increase in funding, child deaths, different reforms, less funding. And I think, which is why I welcome the conversation today, that we need our sector leaders recognise that these are going to be there for a long time. What can we do in terms of use different ways of working, technology, really to begin to address some of the structural deficit issues until such a time the funding for social care perhaps might be seen on the same way that we see funding for the NHS. I mean, that will be absolutely great. But I think the second, in terms of the chart, is actually the answer as well, that whilst we're fighting placements, demand, referrals, the one thing any local authority can do, and I say this to my Solace colleagues, is really to move money away from the early intervention services. And in Bromley, pride ourselves by actually saying that the money going into the budget line for our early intervention service is the same for our frontline specialist social care service, because I do not see the distinction. The temptation is always there for sector leaders to really say we go stop funding early intervention, we wait for the crises, and I can reassure you that if you were to do that, your overall funding over a longer period of time is actually going to be more than what you currently pay. So there is that real focus in terms of early intervention as well.
And I just want to, you know, you're here talking with the world's oldest children's charity. One of the things I observe, which is a challenge of this moment, is that the ecosystem of voluntary effort and of charity contribution has never been more fragile, because it has been affected by the pandemic issues affecting voluntary effort. It's been affected by a major collapse in fundraising. And so, you know, I think there needs to be a three-way conversation, you know, around this conversation, because the total, I'm not sure how much money the magic money tree has so far sprinkled in the UK, but I think it's something in the region of £420 billion worth of structural debt. The total contribution of the British public in donations to all charities is 8 billion. Yeah. Now, the magic money tree could presumably manage a bit more, but also what an astonishing leverage from that. And, you know, what do you reflect really on the role of that ecosystem of smaller, local, voluntary or national charities have as a part to play in this turning the curve?
I think just for me, and I'm sure might be slightly different in the States, I think we're beginning to make the case in the adult social care, and the case has actually now been fully understood in terms of the contributions, not just of the voluntary sector providers, but what we now call informal carers. So we know the NHS will be in a breaking point without the support of voluntary sector providers, charities, and also in terms of informal carers really supporting the sector. And I think, Carol, you're right, that's now been well understood in adult social care world with central government. I think the case has not been fully made in children's services, is my view. I think less has been said in the past years in relation to funding. And I think clearly there is that need to move to the same level, even more than what our colleagues in adult social care have been able to achieve in terms of that narrative.
Greg, do you recognise that from a US point of view?
I guess I would just say I think the conversation you're having is more specific over there, so I'm not really good at commenting on that. But I would say that the way that in the States the federal government structures that money, and there's not enough emphasis being placed on nonprofits and charities, because to my earlier point, information that we all know by past results should garner some type of preventative initiative before something bad happens. Government can't respond to. Someone needs to be able to do that in a less interrogatory kind of way that engages families with help rather than an interrogator. But I would just say that there's a common behavior. The federal government and the way they subsidize state and county agencies will create bad behavior at times. In the United States, the government just shifted all funding away from providing any assistance for group care in order to put more money into in-home family services. And people saw that as, wow, this is great, this is prevention. Well, it's not. It's preventing the need for foster care. This is all post-abuse or neglect happening. But again, the reason they did it was because the states were getting dollar for dollar match on out-of-home care. So when budgets get tight and state general funds start to fall, they need to match dollar for every intervention that they do. So it kind of zaps, local solutioning for, well, we only get a dollar match with this type of program that's supported by the Fed. So just, I would say, moving forward, policymakers and leaders just need to be wary of, how they structure that and the behaviors that happen. And then, in a broad sweeping over shifting of the pendulum, they say, we're not going to do this anymore. We're going to do it this way. And then agencies have to catch up over a period of years, which is going to cause a huge financial strain. So I know that might not make sense to you all in that quick little monologue, but behavior, the money drives the behavior, and the behavior is sometimes not good because of that. And then too big of a shift compounds the problem.
Thank you, Greg. And in fact, when I spoke to Josh McAllister the other day, I said to him, it's incentives we need to discuss. So the same challenge, which is you put the wrong incentives into the system, you will get the wrong result. We're drawing to a close because our time slot is coming to an end. I just turn to our colleagues who are still with us on the call. If you had any final points, please do put them into the chat. And I shall just ask Greg and then Ade for one final reflection before we draw to a close. Can we do it, Greg? Can we rise to the challenge of the post-COVID era?
We have to. It's not about can, we have to.
Yeah.
No, I think that we can capitalize on the wins during this very sad last year. And I really think that moving forward, we can add that needed capacity. We can change the way we work and move those real significant priorities, triage them the right way with eyes on. And a lot of these other things can go to the new modern way of doing business in this world. And I think that that'll really free up a lot of vital resources, and we got to do it, and we will. And I'm glad for the partnership, and thank you guys for having me. Glad to be here.
Thank you, Greg. Ade?
And just really, again, my thanks to Greg and Carol and to colleagues on the call today. I think we must do it. This is actually one of the key things that we as policy decision makers need to take on board. We need really to recognize all the gains during the pandemic, but at the same time still recognizing some of the key limitations. And I'll come back to where I started, which is that we'll continue to build a system that allows individuals and practitioners to spend more time with families and children, and also to recognize that some of our partnership ways of working can go in a slightly different way, as well as use of AI really to push through some of the key things that we deliver in local government. My thanks, Carol, for the invite as well.
Thank you. Thank you both. I shall make two last reflections with my charity chief exec to say the day I'm certain that every single pound is spent to the best level is the day I'll ask for another one. So I shall be asking a great deal in Coram. But thank you also to Microsoft, to Greg for the introduction and for being, along with EY and our founding local authorities, partners in the Coram Innovation Incubator, because its objective is to try to add capacity to this change capability. And as I close, I leave you with one probably misquoted thought from Anne Frank, which is, isn't it wonderful that no one needs to wait a single day before they start making the world a better place? So thank you very much indeed, all of you, for joining us, and on we go to make the world a better place. Thank you very much indeed.
Thank you. Thanks. Cheers, Colin.
Thank you again. Best.